That's so fun.
Right.
No, there's something wrong here, Bill.
What's that? All right, stop.
You're too low. You're at my chin. Can we go a little bit higher?
Yeah.
There,
That's okay,
good.
just leave it on.
Okay, and then Red Grover, send your lesions on over.
Send your legions on.
So you're gonna get to talk a little bit. So what does that mean?
What does that mean?
We're making a joke about Grover's disease.
What does that mean?
You're live.
Oh, we're ready?
Yeah.
Okay. Good morning. We are here to talk about Grover's disease. And so
Want to start all over again?
I thought we were live.
Well, because we thought that you were going to start and then we pressed the button to stop.
Oh, okay. I was ready to go.
Okay, what you want me to say?
Now we're ready to go.
Okay, we're ready. Are we live?
Mm-hmm.
Okay, good morning. Today we're talking about Grover's disease. It's also called Transient Acantholytic Dermatosis. And my staff came up with a cute little joke. We'll see if anybody thinks it's funny. Red Grover, bring your lesion on over.
Haha.
Oh, we got a laugh. Okay. So, for those of you who have Grover's disease, you're probably not laughing. You're probably thinking I'm very insensitive. Grover's disease typically occurs in men over 50, and we're demonstrating on Jose. So you're 55 now?
55.
55 years old, right? You just turned 55. And so it's typically in older men, and it's called transient acantholytic dermatosis. And what that means is it's transient. But in reality, for those of you who suffer with Grover's disease, it actually is typically, excuse me, oops. It's typically not transient. So what happens is that it occurs in 50-year-old men like Jose here, and it's a rash that occurs right in this area here, most commonly. It looks like a red scaly papule or bump in this area. Now, we know that it is a disruption of the sweat duct. We don't really know anything else about it except for that, and we do know it typically occurs in hotter months. Unfortunately, there's no real great treatment for it. We can try steroids. We can try, that's the most common form of treatment. Some people say there was one study that said using a topical antibacterial ointment is also helpful. I've tried that one and haven't had much success with it. A good friend of mine at Mayo actually told me that you can try to use Accutane, and that's an oral retinoid, and there's been some reported cases of success with this. Most of my patients aren't willing to do this though, because when you're over 50, Accutane can actually dry out your skin and it can make you feel worse. So we're going to try to show some pictures of this later on the website. Is that true, Bill?
Yeah, we have a few pictures.
Oh, we have. When are we going to see the pictures, Bill?
In an hour.
In an hour? Okay, in an hour. It gives us all something to look forward to this morning. So did you have any questions, Jose, about Grover's disease?
Grover's disease? No, you covered everything actually.
Okay, yes. I'd like to say that we cured Jose's Grover's disease, but he's never had Grover's disease, and he's actually not 55. He's 25. So thank you all for tuning in.